that a rancher provides medical care to their cattle? Did you ever wonder how they do it? With me today is J.K. Yarborough, Livestock and Natural Resources Agent. He's going to demonstrate some of the ways medicine is administered. Welcome, J.K.
Hi, Miss Celeste.
Tell me what a rancher has to do for their cattle. What kind of care do they need?
Okay, well, cattle, just like people, get sickness. So we try to prevent that by giving them some vaccinations or antibiotics. There's different techniques to apply them. Some are topical, orally, or intranasally, but a lot of them are also straight injections with a needle, like this.
And this is something that a rancher does all the time. So you wouldn't call a veterinarian to come and do these things.
That's right. Depending on the situation and how severe the sickness is, most of our medications are preventative. So that way we try to prevent cattle from getting sick. Those who get extremely sick, then we would want to call a veterinarian.
Yeah, and you're going to demo today some of the injection ways that they are injected with
Yes,
medicines.
ma'am. That's correct. I'll go ahead and say that there's two main methods of injection. There's the intramuscular method and the subcutaneous method. So we take our syringe and we fill it full of our medication.
And that's a big syringe.
Well, it is, because in most operations we have to go through cattle pretty quickly because we have a lot of work to do. So we try to get as much medication as we can, just to keep it, but enough to keep it cool before it gets too warm, before it won't be effective.
Now this isn't medication, it's just a dye.
Correct.
But this is exactly how it would be done.
Very similar, yes, ma'am.
And here you have a cattle hide.
That's
that
correct.
You're going to demo on.
Yes, ma'am.
And so, it's really soft as can be.
There's certain quality methods that most ranchers observe to, called the beef quality assurance. And some of those guidelines are that all injections are to go within the cattle's neck. We put them there because it's a more uniform, creates a more uniform product, and it damages a less valuable product in the end.
Oh, I see.
So our first technique is the intramuscular, where we just go at a 45 or a 90-degree angle, stick it in, depress the plunger, and that's it. The other technique is called subcutaneous, meaning under skin, where we grab a piece of the skin, make a tent with it, we then go at a 45-degree angle, inject the needle, and then depress our plunger and administered.
And it's really not that much different than with a human.
That's
the
right.
way they administer it, except they don't get a Band-Aid, like
That's
a little
true.
boo-boo Band-Aid. So tell me a little bit about some of the kind of medicines that are administered that way.
That's right. We have different types. Like I was mentioning earlier, we have some that are antibiotic and some that are vaccine and some that are also called modified live viruses, where we take a rendered incompatible virus of a certain disease and we inject it into the cattle for their immune system to be able to build up a resistance to that. And that's what's called modified live. Whenever you go to give these injections, all of your medication should have on the label. It will have directions on how to administer and the dosage on all of them. So,
and it's really not much different than our flu vaccine that we get as humans.
That's very true. Yes, ma'am.
So the rancher really has to do a lot to care for their cattle, besides just feeding and grooming and all the things that are for their life. I mean, you're really doing medical care in lieu of other things.
That's true. Yes, ma'am. Very busy.
Very busy. Well, J.K., I want to thank you for demonstrating how to inject a cattle with the medicines that they need.
Thank you for having me.
Now you know some of the procedures that a rancher goes through to care for their animals.